Politics and Ethics, Thelma Brooks, Principles of Public Health, University of New England, June 7, 2017. Ethical concerns are always an issue, and the Not on Tobacco program is no different. The Office of Human Research Protection Statutes 46.116 and 46.117 discusses the general requirements and consent documentation of minors to participate in research. Parents or caregivers were required to sign consent for minors to participate in the Not on Tobacco program. The Children's Health Act of 2000 requires the Food and Drug Administration to bring regulations adopted from the U.S. Health and Human Services and the U.S. Department of Education to provide special protection for children participating in research. Other concerns that the authors could have encountered are issues with confidentiality and follow-up. The participants of the program were to remain confidential. Students were required to be available for follow-up 6 months after start of the program, along with carbon monoxide testing in person to verify no smoking. Many of the students were not available for follow-up because some moved away, graduated, or did not quit smoking. Minimum follow-up documentation led to opponents of the program. One of the main opponents is Why Quit, a website which questioned the 21% quit rates that the CDC and the American Lung Association list on their websites were accurate. The website also states that the authors used funny math relating to the outcomes of teens that quit smoking compared to other programs. Why Quit also asked why the CDC stated on their website that the Not on Tobacco program is a model program when several questions were not answered. Another reason listed as program failure is that NOT consisted of one-day facilitator training of educators already employed at the school. To participate in the smoking cessation program, students were required to limit smoking a certain number of cigarettes per day, including weekends. The students that used oral tobacco were not able to participate in the study, leading some to question the validity of the study because all teens who used tobacco were not included. The study showed that non-rural youth fared better in the study versus rural youth because they were recalcitrant. Snyder stated the most important predictor of health is socioeconomic status. These factors led to rural youth engaging in riskier behavior and having health disparities in future tobacco use related to chronic diseases than urban youth, thus resulting in the need for the program. Appalachian rural youth tend to have higher smoking rates and begin to smoke earlier than youth in other parts of the country. Furthermore, smoking-related illnesses cost more than $300 billion between medical care and loss in productivity if teens continue to smoke into adulthood. Finally, North Carolina is one of 19 states accounting for 80% of tobacco production. North Carolina was one of many states that was involved in lawsuits resulting in the Master Settlement Agreement. Those factors all contribute to the need for the Not on Tobacco smoking cessation program. Understanding that rural youth can be uncooperative at times to authority, developing a program with dedicated days, time, and monitoring versus brief interventions would be more effective. My references are listed below. Thank you.